Okay, let's talk about the biopsychosocial model for mental health. Now, this biopsychosocial model is one that social work really we pride ourselves on in doing our clinical assessments, as opposed to sometimes other fields where they are doing testing and other sorts of things to get at a diagnosis. One thing that we should know as social workers, or the way that we really approach clinical work, is really from a person and environment biopsychosocial assessments. That's how we get at a much more contextualized view of our clientele. Now, here's a kind of a basic model of a biopsychosocial kind of Venn diagram. In this little video, I'm going to focus on the biological factors that we need to take into account. Now, remember, you may be wondering, why in the world are we even talking about biopsychosocial model? Well, one of the things is there is a ton of information that we need to gather using a biopsychosocial that will feed into the diagnostic formulation that we're going to be doing. So the better we are at gathering the information from a biological, psychological, and social standpoint, environmental standpoint, the better our diagnosis is going to be, rather than, no offense to psychology, but rather than just administering a test, getting a very contextualized view of the individual is going to be key, and your diagnosis is going to be much more accurate. So let's talk about the biological here. So I'm going to use this little program here. It allows me to do kind of much more dynamic presentation. So let's focus on the biological. Why is that so important, and what are some of the areas and things that we need to explore when we're doing a biopsychosocial assessment? So when we're talking biology, we're talking about physical health of the individual, kind of what type of lifestyle are they? Are they active? Do they have any illnesses? Things that we need to know about. That plays a big role in our clients' mental health. Are they active? Do they have any conditions that we need to know about? Things that physically are impacting their lives. And we'll go into this a little bit more as far as a differential diagnosis, meaning starting to sort out potential diagnoses based on the symptoms that we have. So in biological, we're taking into account physical health. We're also going to look at any sort of disabilities, or I often phrase these as limitations, potentially. Then we talk about genetic predisposition or heritability, heredity, neurochemistry, kind of the brain chemistry that a lot of people talk about, deficiencies, whether it's serotonin or overproduction of dopamine. Neurochemistry definitely impacts our mental health. And then finally, immune response. That ability to, is a person kind of sickly, to use the word? Do they have difficulties with immune systems, and the impact that has not only on the physical health, but then also how that translates into the mental health. So let's take a look now at the biological aspects that we needed to take into account for a biopsychosocial assessment. This portion here, again, I'm going to go through and talk about some of the things that we need to pay attention to as part of diagnostic formulation, things that you can factor in and that you're going to want to factor in as you're sitting with your client and you're doing the assessment with them. So let's go ahead.